Today, we will be exploring the impact of food insecurity on global health amidst the COVID-19 pandemic.
Before that, we'd like to introduce ourselves. So my name is Aditya Billur, and I am a recent high school graduate from the Downingtown STEM Academy in Pennsylvania. And I plan on pursuing medicine in my future at the University College of Dublin in Dublin, Ireland. And I'm passionate about topics such as medicine and health equity. I plan on, in my future when I'm a physician, I plan on tackling certain systemic barriers to good health, such as access to nutritious food.
And my name is Akruthi Puttaparthi, and I am also from Downingtown, Pennsylvania, and a STEM graduate. This fall, I'm going to be a freshman at Pitt, and I am planning on majoring in both psychology and neuroscience. I also have a strong passion for the healthcare field, but specifically hope to make a positive professional difference through addressing and advocating for mental health care. To begin, it's important to understand the distinction between food security versus insecurity. Food security means that all members in a household are able to access enough nutritious food at all times for a healthy lifestyle without having to resort to methods such as emergency food supplies, stealing, food stamps, or other coping mechanisms. On the other hand, food insecurity is defined as a limitation in the accessibility of resources for safe and nutritious food to support normal growth, and this affects more than a quarter of the world's population. Food insecurity has always been an important issue, largely interconnected to global health, as it can lead to a range of problems such as malnutrition, birth defects, anemia, and cognitive problems, among many others. However, there has only been temporary relief for those struggling, as the issue of food insecurity continues to persist, making food feel as a form of luxury that only some can afford.
So now let's jump into some statistics about food insecurity. So even before the pandemic hit, some 13.7 million households, or 10.5% of all U.S. households, experienced food insecurity at some point during 2019, according to data from the U.S. Department of Agriculture. So that works out to be more than 35 million Americans who are either unable to acquire food to meet their needs or uncertain of where their next meal is going to be. And for which Black and Hispanic Americans were particularly and disproportionately affected. According to the USDA data, 19.1% of Black households and 15.6% of Hispanic households experienced food insecurity in 2019. Additionally, adults who have disabilities, such as, and particularly people who have a disability and are not in the workforce, also experience more than 2 times the rate of food insecurity as adults who do not have a disability. There are many factors at play here, but location is an important one. People who live in food deserts are more likely to experience food insecurity because food is essentially harder to obtain where they live. About 19 million people, or roughly 6% of the population, lived in a food desert, and 2.1 million households lived in a food desert and lacked access to a vehicle in 2015. So what exactly are food deserts? I mean, as mentioned before, it really depends on what setting you live in, whether it's urbanized or rural, and it depends on your access to nutritious food. In urban settings, you need to live more than a mile away to be considered as part of a food desert, whereas in rural areas, this radius expands to about 10 miles.
Building on that, residents are at a risk of food insecurity when they lack a personal vehicle, when public transportation options are limited, or there are only a few neighboring supermarkets. A 2010 estimate from the USDA found that groceries sold in food deserts can cost significantly more than groceries sold in suburban markets. For example, milk prices were about 5% higher, while cereal prices were occasionally 25% higher. From a health perspective, it can be seen that adults who are food insecure may be at an increased risk for a variety of negative health outcomes and health disparities.
So how did the COVID-19 pandemic worsen the current food insecurity crisis? Well, pre-COVID-19, in 2019, the overall food insecurity rate was the lowest it's been in more than 20 years. Yet there have been about 35 million people overall, including nearly 11 million children who were food insecure. And 2 factors that influenced this food insecurity rate included unemployment and poverty, and both of which were at actually a recent low before heading into the pandemic. And as a result of the COVID-19 pandemic, the first economic recession since was seen in the United States since the Great Recession of 2007. And within weeks, tens of millions of people lost their jobs or saw declines in the hours worked. The official unemployment rate for April rose to 14.7%, reflecting the largest monthly increase and the highest rate since 1948, which is when the data first began being collected. So Feeding America conducted a report in 2021, and they found 3 major things. One, people who have been most impacted by the pandemic were already food insecure or at risk of food insecurity. Basically, they're on the borderline before COVID-19. And were basically facing hardship after the COVID-19 pandemic because it worsened their already existing crisis. Additionally, significant racial disparities can be seen in food insecurity, which existed before the COVID-19 pandemic and remain in the wake of the pandemic. Feeding America projected that 21% of Black individuals, that's about 1 in 5, may experience food insecurity in 2021 as compared to the 11% of white individuals. And lastly, it will likely take time for the food insecurity levels to recover, which leads into the graph seen in the left, where Feeding America sort of projects this. You can see like a general decrease in the trend, but then you can see the 2021, and there's a huge spike due to the pandemic and the rising unemployment rates. And the graph on the right explains the trend seen in the racial disparities. So now we jump into our efforts. So understanding that Akruthi and I were privileged to not have to worry about our meal after school or 3 square meals a day, we became more aware of those who did not have the same privilege in our community. And in order to help those who lack this privilege, we centered our senior project around a local food bank known as Lord's Pantry. After contacting the pantry, we were informed that their donations had been sparse due to COVID-19. We took it upon ourselves to plan a safe, socially distanced food drive within our neighborhood to support our local food bank. And we were very glad that it turned out to be quite successful due to the generosity of our neighbors.
And a few months later, we contacted a food truck and the Homeowners Association to plan an event to fundraise for the pantry. To publicize the event, we advertised on social media, made and printed out flyers to put in neighbors' mailboxes. However, for those who did not wish to purchase food but still wanted to help, we also set up a GoFundMe. We were able to donate $1,000 from these combined efforts to the pantry. And seeing the number of people who actively sought out to help the cause showed us that our perspective on the importance of food was shared by many, further solidifying its value. And some solutions to help food insecurity are to support your local county or state's food banks or pantries through non-perishable food item donations, monetary donations, or volunteer work, raising awareness in schools, offices, etc., about the dangers of food deserts and food insecurity, starting conversations with restaurants to repurpose their food at the end of a day by donating it to a homeless shelter or to people in need, meal delivery to seniors, setting up a community garden, and protecting access to SNAP. And these are just a few of the solutions that can be implemented.
So, in conclusion, and to look forward, it is quite good news that overall food insecurity in 2020 may have been lower than originally anticipated in the U.S., and food insecurity in 2021 looks likely to improve relative to the 2020 rates. And it's thanks to individuals, corporations, foundations, and communities that they helped during the pandemic. As if not for them, there'd be more people that would have faced hardship in the past year. And thanks to that generosity, the charitable food sector, including many food banks, were able to rise to the occasion to provide food and benefits to tens of millions of people in the past year. However, the pandemic isn't yet over, and the future remains tenuous for people who have experienced uncertain access to enough food for their families. And it's likely that it will take time for food insecurity levels to recover, as after the Great Recession of 2007, it took nearly 10 years, recently up until 2018, for food insecurity to lower down to pre-recession levels. And even then, 37 million people were still at the risk of hunger. Now, while it may be likely that economic conditions will improve more quickly for this time around, it will take the continued support and public-private partnership across the government, the private sector, and the charitable food system to achieve our vision of a nation and a world where no one is left hungry. And here are our references, and we'd like to thank you so much for listening. We'd like to thank our teachers and mentors for always inspiring us to pursue our dreams and goals. And we'd like to thank our parents and the Global Health Leaders Conference for providing us this platform to converse with you all today. So thank you once again.